Um, my name is Dorothy Colby. I'm the Director of Community Engagement for Hale Ku'ike. Hale Ku'ike is a company on Oahu in Hawaii, and we have 3 adult residential care homes specializing in memory care. We care for people who are living with dementia. And Kay and I work together. You want to say a quick hi, Kay? So she'll be driving the bus of this webinar and keeping things running smoothly. So we'll go ahead and get on started. So this is the 5th, I think, in the series of a Positive Approach to Care webinars. We use the Positive Approach to Care training program at Hale Ku'ike, and all of our public webinars are also part of the Positive Approach to Care training program. Positive Approach to Care was founded by Teepa Snow, and it is an approach and a supportive program for people who are caring for those who are living with dementia. So we start with these basic principles from Positive Approach to Care. Hale Ku'ike is a Positive Approach to Care designated organization, the first one in the nation, we're proud to say. And we really start with recognizing that people who are living with dementia are doing the best they can in that moment, living with the changes that are happening in their brain. And when we can understand what those changes are and how they're seeing things differently than us, then we can change and we can adjust change our reactions to responses. And that's really where today's focus is going to be, around these challenges and challenging behaviors. It's a challenge for all of us. So we're going to dive deep into that today. So for today, we're going to look at, what are these challenging behaviors? And you're already putting answers into the poll. And so there's a lot of things that I see a lot checking off multiple boxes. We're going to look at what makes these things happen, specifically 6 pieces of a puzzle, and looking at what the unmet needs are that are behind the things that we're seeing. And we're also going to look at the brain, because that's the control center. What's happening, and specifically about the amygdala. How is that affecting these challenges that we're all having? We're going to look at what kind of visual, verbal, and touch connections can make a difference. And also looking at ourselves, looking inward. This is something we do with every one of these webinars, because if there's 2 of us, it's not just all about them and what they're doing and the problems they're having. We're in this together, and they cannot do it without us. And together we can move through this journey. So I want to take a moment here, and you started to fill out the poll. You might have some challenges that you didn't see on the poll, but the ones I put on there, those 10s, are some of the most common ones. What exactly are we talking about when you signed up for this? And this particular topic is always the most popular topic, because it can be so hard for not just people caring for someone at home, but professionals as well. And it's a challenge for everyone in the circle. When one person is living with dementia, if you put up your thumb like this and make a big circle, everyone around them is living with it too. We're all affected. So you've thought a moment about what the situations come to mind. I'm going to ask Kay to share she's already sharing the poll here, so we can take a look here. You can scroll up and down to see the results here. So you can see that number 1, I would say most popular, I don't know if it's most popular, but most encountered in this group today is resisting and refusing care. You want me to do something, or let you do something to me, and I'm not having any of it. Number 2 is, let's see, what do we have here? Number 2 would be not changing clothes or bathing. So there's a little overlap in that. But let's say I'm a relatively independent person who's living with dementia, and every time you come to see me, I'm wearing the same clothes. And those are the same clothes you've been wearing all week, Mom. No, I just put this on today. Oh, you can smell it, and no amount of telling me is going to make me do that. I'll insist that I just bathed when that I didn't. It can be really, really hard. And then all of these. So I'm going to flip the slide here for just 1 second. Let's see, and Kay can take the poll down now. So take a look at this list here. You'll see that the ones that were on the poll that you filled out are on here, but there's many, many more. And If you have been caring for someone who's living with dementia for a really long time, you probably have seen quite a few of these. If you're a professional who's been doing it a very, very long time, you have probably seen all of these. But every person is a unique individual. Every person living with dementia, and they're not going to have necessarily all of these during their journeys, but there will be multiple, because the changes in the brain are making things hard, making it hard for me to understand what's going on around me, making it hard for me to be safe in my own home that I've lived in for 50 years. And it's making it hard for me to not just accept help, but to understand that I need help. I just can't see it anymore. I can't see that I am getting lost, that I'm losing things. I think someone has stolen them. I think that, the neighbors are sneaking in and stealing all my toilet paper. The swearing and cursing, that one is especially hard, because swear words, curse words, those things are very powerful words. Those are words we tuck away in our brain. When we're young, the first time we trot them out, the hammer comes down from your parents, like all kinds of scoldings. And oh boy, here locally here in Hawaii, the old days, I remember not just soap, but like chili pepper water. I mean, they're really, really big consequences. So those words have an outsized effect. And so when I'm living with dementia and I'm losing my language ability and my impulse control, those words can come out. We have our impulse control still in place, so we might think them, but we can keep it zipped up and not let them come out. But it can be really hard to separate the curse words from the person. We'll get a little closer into that. And then, as in this list, as going down to these other things here about falls, contractors, more towards the end of life. So the end, closer to the end of the journey, more. So there's a lot of things that we are trying to help and support the person that we love through. And it's we want to figure out where to start. So where do we start? I see all these problems. My mother will not change her clothes. She will not stop driving. She will not, she's taking her medicine wrong. She's calling the cops 10 times a day. Where do we start? It can be really, really overwhelming. So I want to start by, let's take a little time out and everybody take a deep breath. Because even just thinking about those things, it's really, it can bring your anxiety level up. In addition to working at Hale Kuike, I've been there, I think, 16 years now in a professional capacity. I've had many members of my own family who have lived with dementia in their lives. My grandmother had Alzheimer's disease, and my father had stroke-related vascular dementia, and then my father-in-law had Parkinson's related dementia, and each of them were unique individuals, and those are unique diseases that caused the changes in their brains. But what's most important to start with is the relationship. I'm bringing my two hands together. It's the most critical part, but keeping that relationship and seeing the person, and not just the problem that quote unquote problem that they're causing for you, to start with seeing them as a person first, and don't worry too much about the outcome of the encounter yet. We are the key to make life worth living, because people who are living with dementia are living with degenerative brain change. It's a progressive, degenerative, terminal condition. All of the dementias are terminal, so their brains are slowly dying. They're losing parts and losing abilities and losing judgment. There's still a lot of things left, and we'll go into that more too. But we are the ones who can help make up the difference in what is lost, and together is the key to making life worth living. And they really are doing the best they can in any given moment, even though the best they can sometimes is not that great, but they really are doing the best. And we must be willing to take a step back and look at how we can change, because we are the ones with the healthy brains. They cannot change this dementia that they have and what it is doing to the brain. So we're the ones who need to be willing to take a step back and look at it. So it takes two to tango and also two to tangle. So if you take your two hands, I don't know if you can do it, if you do this with yourself, if you take one hand, if you imagine you're doing it with your partner, one is you, and one is the person you're caring for. And if you take your hand, which is you, and push on the other one, say, yeah, you have to take it back now. What happens with the other hand? The more you push, the more the person pushes back. So we want to come together without pushing. Feel that difference. So feel what it's like to push and then get a pushback and then just stop pushing. We want to learn to dance with our partner, to be willing to stop and back off. When you find yourself butting heads, saying the same thing over and over again, I told you, how many times do I have to tell you what time the van comes? I told you 2 minutes ago, it comes at 10 o'clock. That was my grandmother coming out of her room 1 million times a day. And at that time, me, my mother, myself, we didn't know anything about dementia. We thought she was, you get old, you get senile, this is what happens. It was quite a long time ago. But, we lost our patience, and we were the ones repeating ourselves and just keep pushing. And then the more you butt heads, nobody makes any progress. But to be willing to stop and back off. Being right doesn't necessarily translate into the right outcome. There are going to be many, many times where you are right. Take a breath, you're so right. You're right that I didn't take a bath, that I am wearing the same clothes, but I can't see that. And so the more you try and convince me, the more we get into that tangle. So that's a hard thing. It's a hard thing to be right and step away from it, believe me. So why is it so difficult? And if you take your hands and you think about your whole brain, every part, when people think about dementia, and usually the first dementia that comes to mind is Alzheimer's disease, even though there are many, many more, like described in my own family. And the first thing people think of when they think of Alzheimer's disease is memory loss. So that's kind of what people think of. Oh, you get Alzheimer's, you get dementia, you can't remember anything, you can't recognize your family. But I'm going to put another timeout, a pause on that. These diseases that cause dementia affect all of your brain, not just your memory center. It certainly affects your memory center, but all of your brains, thoughts, words, actions, feelings. There are changes in the brain cells, shrinking and dying, and also the chemical production. So there's ups and downs with that. So it's a little variable, and that can make it hard. Different dementias attack different parts of the brain differently. So it's very complicated. It's not just one thing, and it's different in every person. So we want to understand that when we start thinking about these challenging situations, the challenges that we're experiencing, and we want to become a detective. So we're all going to put on our Sherlock Holmes hat or those hard-boiled detectives, just the facts, ma'am, kind of detectives. We want to look at it stepping back. And when you're in the moment and having that conflict, it's hard to step back at that moment, but pause, step away. Perhaps it might have to be a little different time to take a look back and look at these questions separately from the emotion of what's happening, why is it happening, when. Really, really doing this kind of detective work. And you might need to bring someone else in to help look at it with you, because when you're that close, nose to nose with the person, it's hard to see. It's hard to have a perspective. So what we're going to look at, and this is where the handout comes, these 6 pieces of the puzzle. We're going to look at all the different things that affect who we are as people. Now, when I say we, I mean us too. All of us are in this together. We all have brains. And when ours are stressed in caregiving, they don't work so well. No brain works well under stress. So we all need to look at this for ourselves and then also for the person that we're caring for. So these 6 pieces of the puzzle here. The first one, the person, who they were, what kind of things are changing. But if I was always a very detail-oriented person, I was the head of head of a bank branch, and I always have to make sure everybody looked right and their shirts were tucked in. Believe me, I'm going to be still doing that now and scolding people about being sloppy. That's who I am. You're not gonna change that. But it's important to know, and I carry that with me through my life journey, even as I am living with dementia. So it's important, and it's, of course, families know these things about the person, but for professional settings, professional caregivers, it's important that they know too, because without knowing that, it's hard to make that. Again, starts with the relationship. The next piece of the puzzle is a person's fitness, health, and wellness. You know, how well, this is where the medical part comes in a lot. How well am I able to take in food and things? Do I need it chopped or liquids thickened? What kind of medications am I on? How's my sensory input doing? You know, do I hard of hearing? Do I need hearing aids to do that? You know, have I had acute illnesses? So, you know, that is something that is built over a lifetime. So my hearing loss, for example, of course, hearing loss can happen at any age, but let's say the progressive type for seniors, you know, it changed over time, and it built up over time, and it's not something that is going to be rewound right away by any intervention other than wearing hearing aids, and that helps some. But that's something that we try to kind of keep things as stable as possible, is when we're getting to that older age and advancing dementia. But there's not a lot of there's no reversal that can happen. So that, let's go to the next one here. This one, the brain change. This is where we're looking specifically about the dementia, really trying to understand, getting a good medical workup, what kind of dementia it is. And it is important to know what kind, even though there are a lot of similarities in how the personal care would go, whether it's with vascular dementia or with Alzheimer's disease. But there's different things that might be able to help, because perhaps the person is with a vascular dementia, for example, the physician might prescribe something to help prevent future strokes, checking to make sure that it's not delirium. And understanding what their dementia is and where they are in that journey and what's retained, because all through the journey, things are retained. There are things that they still can do and enjoy, and there are ways to connect all the way through the end of life. But this, unfortunately, the dementia, it's not something we can take away as much as we would want to. So these first three are you'll see that they are in a little different color than the next three that come. The stakeholders. So who are the stakeholders? When I did that thumbs up, one person living with dementia, and then that big circle, everybody else around them is living with it too. That big circle around them, it's everybody who has any kind of contact with that person, family, neighbors, the postman, healthcare providers, the caregivers in the care home in some place like Hale Kuike. We are all unique individuals too, with a variation in our history with that person. You know, I might be the daughter, but I had a very rough and challenging relationship with my mother the whole time. And it's not going to get easier with dementia. That's my unique relationship. Whereas there might be another sibling that didn't have that same kind of conflict. So we're each different. And our knowledge of dementia and our skill in being a caregiver and understanding what's going on makes a big difference, and our personal agenda. So everyone around, so this person is a unique individual, and so are each of us. And so the pairings are unique too. The environment. So wherever you're sitting for this webinar, you're all being affected by the environment. Does it feel comfortable? Is it, if something's uncomfortable at all, you're going to want to leave or get up and make a change about it. We respond to the surfaces, the temperature, the everything around, and it makes a big difference. So, you know, even something as little, I remember we had a chair at one of the Hale Kuike locations, and we sat down in it. This is a residence chair, and all of a sudden we felt something poking up and on your backside. It's like, wait, what's going? And I looked at. We figured out one of the little coils was poking up but not through, but it was still uncomfortable. Now we can immediately troubleshoot that and say, oh, something's poking me. What is it? Figure it out. Oh, this. How many residents might have sat in that chair and just like gotten, what do we call it? Restless, right? Standing up over and over again. And what happens? Sit down, sit down. Do you want to fall to sit down? And then possibly agitated from being told to sit down over and over again. But what was the starting point? This chair was uncomfortable. But I didn't have the words anymore to be able to tell you. So little things like that can make a big difference. And then the last one is the time. What am I doing all day? And this goes for us too. Everyone needs time to feel productive and valued, leisure, wellness, giving self-care. People who are living with dementia often don't have the opportunity to give self-care and restorative, recharging our batteries. We all, if you were to draw a pie chart for yourself of those four things, there might be parts that you wish were bigger or smaller. But if you think of the person who's living with dementia that you care for, chances are the productive and the wellness are probably pretty small wedges. The wedge that becomes very big that we have almost none of in ours is the fifth one on this: waiting for someone to come and help me, waiting for the meal, waiting for someone to push me down the hall, waiting. That wedge is really, really big. And when we think about us as human beings, how well do we do at waiting? How well do you do waiting in traffic? Our brains waiting in line. If I go into a grocery store and I see there's a really long line, like a lot of people, I'll turn around and walk out because I'm like, I'm not doing this. And if we are forced to wait, we start to get what? Restless, agitated. We have our phones now to help distract us, but boy, we are really not good at waiting. And neither, just human beings, just like same as us, people who are living with dementia, waiting. If there's any waiting time, they have to get up and go, or calling out, things like that. It can be really tough. So let's take a step back and look at these 6. The bottom 3 are in blue, because the top 3, when you look at them, we as family members, even as professionals, even healthcare professionals, how much influence do we have on those first top 3? With the wellness one, we can certainly help a lot, but in terms of moving the needle, we're kind of trying to keep the status quo on that one. We're trying not to get worse, but we don't have a lot of influence on those top 3. The bottom 3, stakeholders. What kind of stakeholder are we going to be? One that makes things better? Neutral? Like, well, it's, we're doing okay, but not better or worse, or dragging down. Now, thumbs down is always like a bad thing, but I don't mean in a judgmental way, like just, I am not able to make this situation better. And when I'm there, it's worse. I just, either I can't help it. Of course, the person living with dementia can't help it, but every stakeholder is somewhere in that spectrum. And how can we bring together a team that's at least here and hopefully here, right? So looking at that, we have a big influence in that area. The environment, again, those are things that we can change. So stakeholders, we can change ourselves. We can figure out who's good at what in the team, build a positive team. And time, we have an influence with that too. What happens during the day, looking at the day. So these 3 things, while they cannot erase the dementia, can make a huge difference in the quality of life. And by improving that, the reducing the challenges for everyone. So I'm going to flip to the next one here. So those are kind of the pieces of the puzzle that you'll be looking at. So when you have a challenge come up, looking at what is it within the realm of the environment or the stakeholder, or try to see what it is. Could be the medical part. Maybe do I have a UTI that's kicking things up? But how am I person living with dementia able to express to you that something's wrong. This chair is poking me in the butt, right? I don't like you touching me in my private area, trying to give me a bath. How do I let you know these things? Well, sometimes in the earlier stages, words are still available. But as time goes on, maybe not so much. And also my impulse control is changing as well. So like I was talking about the words before, swear words might come out. But I want us to take a look at, again, putting on their detective hats. When we start to see expressions of emotional distress, or when I see distress, is it an emotional distress or a physical distress or some kind of combination? So let's start with the physical one. So if you put your hand up like this, 5 physical needs. The first one, you can put your thumb like this, like suck them up. Intake, hungry or thirsty. Am I hungry or thirsty? Sometimes it might be as simple as that, but I can't express it, right? So this is missing. Second finger, energy. I have a lot of energy, right? I have energy to burn. I won't stay seated. You know, if you don't help me burn this off, I'm going to be getting into things. Or the opposite. I'm tired. I just have no energy. So up and down energy. Number 3, your middle finger. If I'm dangling it down here, I have to go, or I did go. So I feel I have a BM coming, but I can't tell you, but I'm starting to not stay seated, or I'm starting to be really uncomfortable. Maybe I'm constipated, and I start to grind my teeth, and it's like, what is wrong? You know, and I'm trying to help you, and I'm striking out. It might be, take a deep breath, step back. Well, let's take a look. They haven't had a BM in 4 days. Or it might be, I just had one, and that's uncomfortable. If you can imagine having a BM and what that feels like to be sitting in that is uncomfortable too, but I can't express that. Of course, you might smell that before, but number 4, discomfort. It's hard to lift this finger up. That's a good way to remember. Temperature or sensation. It's too cold in here, too hot. This chair is uncomfortable. And then the last one, small, but so mighty, pain. So many of our elders have chronic arthritis, constant pain. But the people who are living with dementia, unable to express pain. Are you feeling any pain? No, I'm shaking my head. Of course, the person I'm asking the question with dementia is probably also mimicking me, shaking my head. No pain? Oh, okay. They don't get pain medication at the same rate as people. They get it at a much lower rate than people who are able to say, you know, oh, my shoulder hurts, my knee hurts, or show me where the pain is. People who can participate with that type of question, they're living with pain more than people who aren't living with dementia. So that's something to really explore with the physician, especially if it's something changed. Maybe I had a fall and you don't know it, and I've broken my hip and gotten back up, because you and I couldn't do that, get back up from falling and breaking our hip. But because of the change in the brain and the way the pain is processed, I've gotten back up, and now I am really having an expression of it. It might even look like anger to you, but it's pain. So looking, a detective, 5, you can tick them off. Are they hungry? No, they just ate. They had a good night's sleep. Nope, they had to be, you can tick them all off to try and see if you could find any of the 5 physical needs. So on top of those 5 physical needs, I'm putting one hand over the other one, 5 emotional distress. So if I have those physical needs, I might express them in one of these emotions that you see, but I also might not have any of these physical needs, but I have these emotional needs. Our emotional needs are as important as our physical needs. 5, first one, put your thumb up, anger, and then you can put your thumb over all your other fingers to make a fist. Anger sometimes covers up the other emotions. You might see anger expressed first. I'm shaking my fist at the camera here. You know, you get out of my room. I just want you to go away. And that's a way I can really, you know, kind of like the way roosters fluff up their feathers. I can make yourself, I can scare you off. I can keep you at bay. Second one, sad. Put it right here. I, I, I don't know what to do. I don't know where is my family. I'm feeling this genuine emotion here, and it can be really hard. These emotions here, angry, sad, lonely, scared, bored, those are hard ones for us. We love happy, cheerful, things like that. But these are hard to confront and work and to work with, because they're difficult ones for us to, even in ourselves sometimes. Second one, lonely. I can feel lonely even in a place with many people around, even with my own family around, because I don't know how to. I'm having trouble connecting because of the change in the dementia. A lot of loneliness right now during the course of the pandemic. Isolation is a big real source of loneliness. The fourth one, scared. That one's often covered up with anger, right? And then the last one, another small but mighty, bored. There's nothing to do around here. I'm just disengaged, and that can also lead to, getting into things you might not want them to get into. But if you look on this 5 emotional needs, notice they don't just start out with furious, for example. It starts here. So if you put your hand here, all these emotions start at a lower level and work their way up, right? When do we generally respond to things? So if someone's just kind of fidgety, we generally tend to ignore it because it's not demanding our attention. It's only when it gets way up here is when we're like, oh my God, it's like a big disaster now. And that's when, generally for professionals, when we see and meet the person when the challenges are so high, that the geriatrician, the geriatric psychiatrist, or even a care home is in the picture, because it's just so up here all the time that we don't know what to do. So when someone is distressed, so I'm talking here, this high level up here. We have a previous webinar on the positive physical approach. But if you grab the thumb and say, calm down, if you try and pull someone down, like, calm down, mom, just calm down. You don't have to. When someone has told you to calm down, how well did that go over with you? When you're really upset about something, don't tell me to calm down, because you're telling me how I'm feeling is not valid. We want to, when someone is up here, we want to come right up below them. So someone is up, they stole my purse. Someone stole my purse. Or I got to call the cop. Give me the phone. I want to come right underneath. So someone stole your purse. That is terrible. That should never have happened. And I'm going to start to bring myself down, connect with them together till we can move to a new place. But trying to confront someone, especially telling them, no, nobody stole your purse. You hid it in your own, bedside table. It's right here. No, they put it there. The more you do this, the more I stay up here or even get farther or lash out. Get out of here. You're full of, what. So when something you were trying is not working, you want to back off. So when you feel yourself doing that, find yourself doing that, back off, think it through, and then try something different. Trying something different might be somebody else might want to try instead of you, because sometimes, like I said, you're too close to see, to be able to see in that moment. So I want to take a look at these brains. We're going to look really close at which part of the brain, when we're here, when we're having that high emotional state, our primitive brain takes over. And so this first column is a normal brain, and then this is early Alzheimer's. The slice kind of goes this way. This is the front of the brain, this is the back. And then these are later, towards the end of life Alzheimer's, and this is an 18-month-old child. And you can see in the circle, the primitive brain, you see changes. So while other parts of the brain are moved from the red high activity to having less of that as it goes on, the primitive brain still remains and still is very, very, very active, because it is what helps us, what makes us be able to survive. It's our thrive to survive. So that does not go away. It's our fight, flight, our pleasure seeking, all things that run our vital systems that we don't have to think about, hunger, thirst, all those things. All of that is in charge. Your primitive brain is in charge of all of that, and specifically our amygdala. that threat perceiver, pleasure seeker, your left and right amygdala, those are the ones that really kick up when we perceive threats. So I'm going to bring this up here. Here we go. Other parts of the brain have a lot of changes too. Language changes. This is the healthy brain and someone in late stage dementia. Vision changes, changes in visual perception, like it becomes very binocular, binocular vision. Changes in the frontal cortex, that's this part here, reason, all those together. So I'm not understanding what you're saying, even though you think I am. I'm not seeing things, physically seeing them the way you think I am. And I'm not judging situations, including you, your friendly help. I'm not judging that in the way that you think I am or you think I should. In our efforts to help, sometimes we are inadvertently perceived as a threat. Like, I don't understand why you're touching me. The left amygdala, that's my left, turns on, and that's the fight, fright, flight. And once that's up, it's hard to make that connection. It's hard when you almost get hit by a car, or something really life-threatening comes at you, you feel really, really scared. You're fighting for your life. And even though this situation that you're in with this person clearly is not life-threatening, you're just trying to help them with their personal care. You had a BMI, I'm just trying to, that's not how I'm seeing it. And it can become dangerous for both of you, because I really, truly feel you're trying to hurt me. And I can't understand it. And it's not because you're doing anything that is actually trying to hurt me. It's because of the changes in my brain. And it will lead to those situations of getting hit if you're not careful, or things can't be changed or helped in some way. On the other side, when I need relief, when I need seeking pleasure, I want it, and I want it now. And if I don't get it now, that also leads to ratcheting it up my response. So I start with liking something. Oh, I want it. Now I really need it. And if I don't get it right now, then those kind of behaviors that you see will come out. I'm going to switch from calling them behaviors now to expressive communication. So I'm expressing my need, not in a way you like, or sometimes in a way that you can understand, but I am expressing it to the best of my ability. And on the left, we're always scanning for our own safety, right? Then, now it's starting to seem risky, it's going up, and then actively dangerous. And that's when our fight, fright, flight kicks in. Some of us are more fighters, and you know who you are, probably. Some are more flight, like I got to get out of here. And then the other one is freezing, fright. So I'm terrified. I'm not hitting you. I'm not running away, whimpering. You're getting me cleaned up. And what do I get? Patient compliant with care. Yeah, maybe technically, but how am I feeling emotionally? There, I'm giving you signs there that my amygdala is through the roof. So we want to work to make sure we can get that connection first, the relationship first, before I get in there to do that personal care, before I try and give you medication, before I tell you not to go out that door. Getting connected visually first, because the vision is changing, using language or visual cues that work for me where I am, and getting connected as a human to human. This is where that positive physical approach comes in. A lot of times, if we find ourselves in front of the person, we are confrontational just by where we're standing, even though we don't mean to be, versus supportive stance, being a little to the side here, whether it's standing or sitting, can make a huge difference. Coming from the front, especially close up, you're just trying to help them with their clothes or whatever you're trying to help them with, but it feels like you're coming at them. So visual cues, keeping it simple, hand in hand. I want to touch on, there's a recording that's available of the GEMS workshop. So the journey of dementia, starting from sapphires, that's us, true blue. We are experiencing brain change as well, not from dementia, but from aging. So we're all experiencing brain change. It might take us a little longer to remember those words, but we can still get there. All the way through diamond, emerald, amber, ruby, pearl towards the end of life. So each of our loved ones is at a different spot. But I want to focus on ourselves at the moment, because when we're under stress, and caregiving is so stressful, both professional and personal caregiving. And many of you professionals out there, I know, like myself, also are or were personal caregivers as well. Our sapphire brains can move to diamond. We become repetitive, cutting, rigid, and our brains are not functioning as well. And we're supposed to be helping each other. One person's living with dementia. If the other person is functioning as an early stage person living with dementia, how far are we going to get together? It's going to be really hard. So when you find yourself butting heads, I want you to think for a moment to those things you filled out in the poll. Number one for a lot of people was the personal care, but whatever it is, if you think of one of those things that is a trigger for you. So for my mom and for me with my grandmother, that example I gave of coming out over and over again. What time does the van for senior citizen comes? What time? There was something about that was just like, that's like 20 times. It was definitely a trigger for us. We would be cutting when we love my grandmother, but the 20th time she would come out before she even got a chance to answer the question, we would turn around and say 10 o'clock before she could answer. How rude, right? But we didn't know what else to do. We were stuck in that rut. We didn't know how to make something different. So for yourself, for a moment, and I'll use for myself, I'll use that grandmother. Think about it. You can jot it down on a piece of paper, or you can use this later. You can print it out from the slides if you want to, after I send you the slides. What is a trigger for you that makes your amygdala go up, makes you go diamond? And what one thing can you try calm your brain to regain your composure and calm your brain so that you can think clearly? Because we, the person living with dementia, both of you need you to be healthy and to have a fully functioning brain to be able to get through this together. So just take a jot down, just one thing, and think about the next time that thing happens. So the next time my grandmother comes out, instead of just giving her the 10 o'clock answer over and over and over again, because it's clear it's not sticking, right? It's like I'm expecting a different outcome, but I'm doing the same thing too. So that's not going to make any difference. What could I have done differently? Oh, you're worried about when the van comes. Oh, well, while we're waiting, let's go check out the flowers. So let's go check out the garden. So she's still worried about, but can we move to a different place? Every time she goes back in the room, she's going to wonder when she's going to be doing that. But I can change the environment. I can make a little bit of a change. Let's sit down and have some, coffee or tea. Just to be doing something else, something that I could do, because she couldn't change. She was like a record stuck in a scratch. That's an old reference, by the way. Younger people don't have that experience, but she was stuck, and so were we. So we want to make sure, as caregivers, we build a team early. We want to be able to step, even at the earliest stages. We want to try and respond instead of just reacting in the moment. So a lot of times these kind of challenges that come up, especially as it progresses, it's new. Like we've got this. I got this routine. Everything's going fine. Mom has breakfast at this time. It has to be a papaya and oatmeal, this and that, everything. Okay, that all works great for a certain amount of time, but my brain keeps changing, and you're changing too. Things get busier. Something changes in the environment, and then we get surprised by something, and maybe we do react or overreact. Pause. Let's take a time out at the moment. We're only human. but we can learn. Our brains, that sapphire brain is flexible, able to learn and to change. So we want to make sure that we bring stakeholders, people around us to help everybody, and not just help the person that you're caring for, but you as well. And it might be your family, it might not. There might be only certain parts of your family. That was the case of my family. And it might be professionals, but we're all in this together. We're all in. Things that don't help, arguing. You can argue till you're blue in the face with me about if this is the same shirt I was wearing all week. I don't know. Have anybody ever won an argument with somebody? No. I mean, maybe both sides ended up in tears, but that's not winning. You can ignoring it, trying a solution only one time, giving up, or forcing. Those are all things that kind of tend to escalate instead of calming and then moving together to the new place. So building skills, things like attending these kinds of webinars, trying out the things that you learn in them, not just mine or other people's that you've learned from. It's hard to try a new skill sometimes. So like that one you just wrote down about, okay, next time my mother comes out and asks me the same question a million times, I'm going to say, oh, you're wondering. I'm going to take a deep breath. That's the first one. Take a deep breath. Oh, you've been wondering when the van's coming. Oh, yeah, well, I'm wondering too. Well, let's sit and have a cookie while we're waiting. Just making yourself do that the first time can be really hard. But remember, who has the healthy brain? And remember, people living with dementia are really doing the best they can. And please give yourself the grace and leeway that you want to give to the person who's living with dementia. You will make mistakes, and so will your family members, so will professionals. But we learn from them and move on. We recognize those like, uh-oh, that didn't go like I wanted it to. Back off, rethink, and try something else, and forgive yourself and all those around you. We're only human. This is not easy, but we can move through life and this journey with dementia and have those positive moments of joy all the way through. So getting help, support for you. Check out all your options. You might not need them now. Day programs, residential care, but knowing what's out there, planning ahead. It's when, not if, looking at it that way. Maybe you might not need it, but it's better to be prepared and to bring a team. So as early as possible, bringing people together to support you and the person that you're caring for, and watching yourself for signs of burnout before burnout happens, and setting limits. So it is not a sprint, it is a marathon. My grandmother probably first started having symptoms of dementia, which of course we didn't realize dementia, probably in 1985. And she had Alzheimer's disease specifically. We didn't know that at the time either. She didn't pass away till 2001. Extraordinarily long journey for her. Other family members was not quite so long, but still. It is not uncommon for a caregiver to have extreme burnout and not to be able to continue. Your own health can be affected. So getting help, taking time away, and sometimes you need to relearn the listening, to be able to step away and to have someone in your life who can listen to you as well in a non-judgmental way, because you're not being a bad son or daughter, but if you need to vent sometimes, it's healthy. And getting professional help as well, help from a therapist, can make a huge, huge difference. Your mental health is as important as your physical health. It's very hard. These ones here are challenging because, how it used to be, how it should be, how you should be. If I were a better daughter, I'd be able to do this. I promised my mom I would never put her in a care home. Take a breath and best you can, try and let those go, to be able to step back and look at the now, because it's about the now. You now, the person you love now, what are both of your needs now? And how can that best be supportive? It might not be how you wanted it to be in the past or you think it should be, but really what it is, and get a team to help you through that. So the person who's living with dementia, I am who I was, but I'm different, but so are you. This journey changes you as well. And you're growing up and getting older. So figuring out who does what on your team. Not everyone is meant to be a care partner for living with dementia. We find that in professional settings too. It's a different kind of care. It's cognitive care, not just physical, not just making sure you're clean from incontinence accident and get to bed on time and wearing clean clothes. It's cognitive and emotional support. So I'm going to make sure we have enough time for question and answers. I want to thank everyone for coming. Kay is going to come back on camera here. We do have these webinars the first Wednesday of each month, and we do have the recordings of this year's webinars on our website. Catholic Charities last year, 2020, we did a series of 6. Kay and I are doing a series of 7, right, Kay, this year? All those recordings are up there and free of charge. So we're going to go to Q&A.